Is healthcare an investment or a social service? So I decided to ask 6 global health experts from Australia, Ghana, Kenya, Nigeria, South Africa, and the United States. These are their answers.
Hello, my name is Dr. Stella Busire. Is healthcare an investment or is healthcare a social service? I want to believe that healthcare is both an investment and a social service. When you think about healthcare as an investment, number one, think about the aversion of costs when our population is healthy, and particularly when we have early diagnosis, when we have early treatment, we're able to avert higher costs in the future because of complications. Think about productivity. When people are healthy, that means they can actually be able to afford more time at work, and this contributes into the growth of the economy. When a population is healthy, it can also lead to increased lifespan. It both actually improve the quality and also the length of time, in terms of the quantity. And that means, again, they can actually rechannel that good health into the economy. But also broadly think about the healthcare industry. It's a huge industry that has grown over the years, where people are able to be employed, the government is able to get its taxes, because of either manufacturing or sale of commodities, and the innovations and technology that are coming out over the years. But also healthcare is a social good. Number one, right to health. Most of the countries in the world actually have defined health as a right for each and every individual, and so it is a social service that needs to be availed to everyone.
Is healthcare an investment or a social service? My answer is it's both. Firstly, you cannot have equitable health outcomes without a well-established infrastructure of primary health care. And all achievements of modern science and the practice of medicine requires people to be able to have access to health services and health facilities that are of quality. But we also need the underlying determinants of health, which often lie outside of the health system, such as systems of social protection, in order for people to realize their right to health. Now, the right to health is a human right. It is the language of obligation, especially on the parts of the state. And so when meeting their obligation on the right to health, they have to protect, respect, and fulfill this right using national, district, and of course, local and community-based health systems. And of course, it's important to remember that without investments in healthcare, many people around the world are always going to be at the mercy of charity or philanthropy. And so we have to reinforce the message that investment in the healthcare system is an investment in human rights.
Hi, my name is Eliza. I'm an artist, designer, and educator based in Providence, Rhode Island in the US. I believe that healthcare is a social service because every human being has the right to good health. Our ability to participate and contribute to society is contingent on our health, our well-being, and whether our human rights are protected. A person can choose their own priorities when their health is taken care of. They can choose to have a family or not. They can choose how they would like to educate their children. They can choose the type of work they engage in. They can choose to care for our planet. None of these choices can be freely made if we are struggling to be healthy and to access care. Additionally, I believe health information is a social service because information is necessary for empowerment. Health information allows people to make the choices that are best for them and their loved ones. In my work as an artist and designer for global health, I'm interested in how we make health information accessible to all, regardless of language or literacy barriers. When people have the information they need, they can make their own decisions and access the care that they need. They can participate fully in society, and we have a healthy and thriving global community.
To the question whether healthcare is an investment or a social service, as a physician who is a nephrologist, I've come to believe that we cannot keep thinking of healthcare as just a social service. Healthcare is indeed an investment, and it's indeed an investment because when health policy makers think of it as an investment, when you are putting it in, you know you are going to reap the desired benefit. where people are going to stay healthy. They are going to actually give back to that society that has invested in them. Those who are also investing in healthcare would make sure they put in the best for quality healthcare, which at the end of it all is going to help improve the health system. If we keep thinking of health as just a social service, we'll continue to be where we are, where people don't want to invest because they don't see it as an investment, and the people who are involved don't get the best out of it. Thank you very much.
Hi, Fanny. Thank you so much for giving me the opportunity to reflect on the question that you sent, which is whether healthcare is a social service or an investment. For me, clearly, it is both. Healthcare is a social service because everyone deserves access to quality, equitable, and affordable healthcare, regardless of their ability to pay. But let us not kid ourselves. Healthcare is an investment. We must invest in well-functioning quality hospitals and health centers. We must invest in well-trained and well-paid health professionals. We must invest in a robust health information system that allows citizens to be active parts of their health sector. And we must invest in research, in cutting-edge research that helps us solve the problems that we face today and also helps us anticipate the problems that we will face tomorrow. I think of the COVID-19 pandemic and other emerging diseases with pandemic potential. We cannot build a robust health system if we cannot anticipate these issues. So healthcare is an investment, but the returns on that investment is a society that is flourishing, one that is productive, one that is healthy, one that is not only free of illness, but also filled with physical, emotional, mental, and economical well-being. And that is one of the most profound investments you can make in any society. So healthcare is a social service, but somebody must pay. Thank you.
While Indigenous Australians have been thriving and sustaining our lands for over 60,000 years, we still face a burden of disease over 2 times more than any other Australian. With this, to advance Indigenous health outcomes, it requires a holistic view, a view which recognises the influence of social factors and the strengths of our culture as a protective influence on our physical, social and emotional well-being, what we deem social and cultural determinants of health. This type of approach provides the best opportunity for me and for all Indigenous Australians to live long, healthy lives which are enriched and centred in our culture. It would ensure programs and services focus on prevention, are equitable and are culturally safe. This is why I believe an investment to healthcare is an investment to social services, an investment which needs to be locally led and flexible to be responsive to local contexts and local needs as they change, as issues arise, or as we all live more healthily.
So you've heard from these 6 global health experts from 6 different countries. What do you think? Is healthcare an investment or social service? I'd like to hear from you. My name is Dr. Ifeanyi Nsofo, and I'm a Senior Atlantic Fellow for Health Equity at George Washington University. Thank you.